Breast cancer is the second most common type of cancer in women. However, it has never been more common among females of age below 40. United States Preventive Services Task Force now recommends biennial screening mammography every 2 years for women at the age of 40 to 74.
Now to news that affects millions of women in America. The age women are expected to get their first mammogram is moving up by a lot.
Yeah, an influential U.S. health task force has reversed course on a previously controversial recommendation.
They now suggest mammograms begin at age 40. That's 10 years earlier, where they used to be. Dr. Frank McDougall.
In 2009, it was interpreted by United States Preventive Services Task Force that the risk of getting false positive finding leading to more testing and negative outcome was preferably more below the age of 40. Hence, the USPS task force initially recommended that women should begin biennial screening mammography every other year at the age of 50. USPSTF previous recommendation has been in contradiction with other medical groups, including the American College of Radiology and the American Cancer Society for many years, who suggest mammograms every year instead of every other year starting at age 40 or 45.
The American Cancer Society, the American College of Obstetricians and Gynecologists, the American College of Radiology, and the American Society of Breast Surgeons.
The question arises that why did the USPSTF now make this drastic change in screening mammography from age 50 to age 40? Do women really have to undergo breast cancer screening every 2 years? Or has this disease become contagious? Are young women not safe anymore? I know you want answers. Let's find out by expert doctors and specialists what they have to say about it.
And die of breast cancer in the U.S. each year. The new guidelines would cover more than 20 million women between 40 and 49 years old who might be at risk. But women with a family history of genetic risk of breast cancer are advised to get screened earlier.
Why do younger women get more aggressive cancers?
We think that's because young women are more likely to not be screened, and so their tumors are bigger by the time we find them.
United States Preventive Services Task Force is an independent, influential task force of medical experts committed to providing evidence-based guidance for the screening of important diseases.
U.S. Preventive Services Task Force. Now, this is the task force that is charged with coming up with the most evidence-based guidelines for the screening of important diseases. Their guidance is relied on by health providers across the U.S.
Recently, on Tuesday, April 30th, 2024, USPSTF published new recommendation statement on breast cancer screening, bringing drastic fall of 10 years gap from age 50 to age 40 for women to undergo biennial screening mammography. We make this new updated recommendation because the latest science clearly shows that starting at age 40 and obtaining a mammogram every other year until age 74 can further reduce deaths in breast cancer, said USPSTF Chair Dr. Wanda Nicholson, a senior associate dean and professor at George Washington University's Milken Institute School of Public Health. We can save even more lives, up to nearly 20% more lives with this updated strategy, Nicholson said about the new recommendations.
That by starting at age 40 and screening every other year until age 74 can save even more lives from breast cancer, and in fact can save up to nearly 20% more lives. And this corresponds to about 25,000 more women whose lives are saved. We think that's a huge win for women.
The updated USPSTF recommendation is applicable on everyone given the gender of a woman at birth, including cisgender women, transgender men, and non-binary people who are at average risk of developing breast cancer, as well as those with a family history of breast cancer or dense breasts. It seems that these recommendations are particularly for those who have more average risk of developing breast cancer. See what Chief Health Editor Dr. Partha Nandi say about it.
News, though, that they've recognized the benefits of screening younger women. They're now recommending regular mammograms every 2 years for women between the ages of 40 and 74. However, this new guidance is specifically for those who are at average risk. It's not intended for women considered higher risk, like those who carry what's called the BRCA1 or BRCA2 genes, women who've had high-dose radiation therapy to the chest at a young age or have had high-risk breast lesions on previous biopsies. The decision update, the guidance really comes from concerning trends in breast cancer rates among women in their 40s.
Moreover, Dr. Carol Mangione, professor of medicine and public health, UCLA, expressed her opinion on the recent change in recommendation as the inclusion of recent science and associated benefits and risk of mammography for women.
Well, actually, our task force has said that we should use mammography selectively in women at the age of 40 after a discussion with their doctor, going over their own personal preferences and risk profile. But now, with new and inclusive science, we're able to extend that recommendation to all women.
But the issues remain at the point where USPSTF is still in contradiction with other health organizations. Dr. Robin Gartner was interviewed by PBS NewsHour, and the concerns she raised about the recent recommendation make sense.
These guidelines are out of step with some advocacy groups and medical organizations. I spoke earlier today with a board-certified radiologist, Dr. Robin Roth. She raised some concerns. I want to play for you some of her comments and then ask you about them.
I think that they missed the mark in a number of ways. The largest way being the every 2-year screening interval, which experts like myself will tell you that annual screening mammography saves the most lives. These guidelines do not endorse supplemental screening in women with dense breast tissue, and I think that is a major downfall of these recommendations.
Dr. Wendy Berg from University of Pittsburgh School of Medicine wrote in an editorial published Tuesday in the journal JAMA Oncology, wrote, "Using USPSTF terminology, annual screening is just as efficient as biennial screening but produces greater overall reductions in late-stage disease and deaths due to breast cancer, and greater gains in years of life saved." Berg also wrote, "The updated USPSTF recommendations are an important step forward, but they stop short. Annual mammography is as efficient as biennial mammography, but with greater overall gains in years of life saved. Annual screening is particularly important for premenopausal women, especially women in racial and ethnic minority groups." Despite contradictory review and critics on the recently published breast cancer screening recommendations, USPSTF members found no evidence to support screening annually, Nicholson said. Nicholson made clear point on how the task force has built a favorable balance in her interview with PBS NewsHour.
Well, the task force's role is to look for the strongest evidence possible to help guide women as to how they should be screened and how often to be screened. And when we recently looked at the evidence and looked across all the evidence, comparing the benefits and harms of different screening strategies, we found a much more favorable balance of benefits and harms for individuals undergoing screening every other.
In a nutshell, the consistent increase in the breast cancer cases under 50, the increase in death ratio of Black women as compared to white women diagnosed with breast cancer, and other factors have caused USPSTF to consider their outdated recommendation and issue a new statement more aligned with other health sectors.
It was after an increase in diagnoses of breast cancer among younger patients and an alarming number of deaths among Black women, who are already 40% more likely to die of breast cancer.
It's a higher cancer death rate than white women. They're 40%, that's right, 40% more likely to die from the disease. So early screenings can help save more lives, and evidence.
Bottom line, though, is that women with average risk of developing breast cancer start biennial screening mammography at the age of 40. This helps diagnose the disease early before the infection starts to spread and reduce the risk of dying from this disease. Finally, it should be noted that cancer is a dangerous disease that can be prevented in a number of ways. Cutting back on your consumption of fat is one of these. Eating a lot of fruits and vegetables is another strategy to combat breast cancer. Numerous fruits and vegetables have compounds in them that may be able to combat cancer. According to certain research, breastfeeding for more than 4 months reduces the chance of developing cancer. According to a recent study, women who have had breast reduction surgery had a 40% lower risk of developing breast cancer. Do let us know your views in the comments below. If you like this video, hit the subscribe button and press the bell icon so you're notified as soon as we upload our next video. Thanks for watching.
The opinions expressed in this video are solely those of the individuals presenting them and should not be considered as absolute facts. Additionally, any impersonations depicted are purely fictional and not intended to represent real individuals. Viewers are encouraged to conduct their own research and exercise critical thinking when interpreting the content presented on our channel.